key question is what sort of welfare state is going to remain after the deficit is finally cleared at the end of this Parliament if his plans work out. Quite clearly, it's going to be something very different, I think, to what we've been used to since 1948, involving a much greater responsibility on the individual to safeguard their own well-being, on the family to offer support wherever possible. Just listen to Jeremy Hunt's repeated praise for what he thinks is the Chinese model of care for older people. And on the community to wrap itself around both individuals and families, perhaps, in my view, necessarily incentivised to do so. Thus, a huge need and potential for organisations like Help and Care, working at the sharp end from a community development perspective and background. Thinking specifically about the shape of health and care, it probably pays to revisit last year's Barker review for the King's Fund, rather ignored at the time, but I think very insightful in its recommendations. Single ring-fenced budget for NHS and social care with a single Commissioner of Services, new forms of state funding through national insurance and wealth taxes, but also means testing of older people's universal benefits and lifting of some prescription charge exemptions. And a new care and support allowance for people with moderate to low needs, enabling them to buy their own support, and free social care initially for all those with critical needs, perhaps extending later to those with substantial needs. That kind of mix of integration, further personalisation, and some pretty hard choices on funding is likely, I think, to be what preserves the fundamentals of our free NHS and preserves them through growing local variation under devolution deals.